Welcome to Integrative Medicine with Dr. Leland Stillman, the podcast where we explore the best of East and West, old and new, conventional and unconventional, in search of answers to medicine's toughest cases and most difficult problems. This podcast is for informational purposes only. Diagnostics and therapeutics discussed on this podcast may or may not be right for you. So talk to a qualified practitioner before taking action based on what you learn here. If you'd like to become a patient at my practice, go to stillmanmd.com to schedule a complimentary discovery call. Thank you for listening and welcome to today's episode. Emily, thank you for sitting down with us.
You're very welcome. It's nice to see you.
Good to see you too. So I'd like to start by asking people where they were with their health and what brought them to seek our care.
I was diagnosed with an autoimmune disease when I was 17. I'm 35 now. Myasthenia gravis. I don't know the statistics of it now, but it was pretty rare for a pediatric patient. I had a pretty tumultuous history with it. I was in and out of the hospital pretty regularly. I want to say it was about 12 years. And I would have breathing issues, swallowing issues. It would be every time that I went into the hospital, it would be just to monitor to make sure that I wouldn't need to get intubated.
For people watching, this means that this disease, when it gets rolling and someone's having a flare, people tend to go into respiratory failure, which means that they are not able to continue breathing and they have to be intubated. So it's very common for us to meet these people in the ICU, in the respiratory care unit, step-down units in the hospital. So I got to know people like Emily in residency when they were usually coming off the ventilator, and we were always nervous about them having to go back on because that was not uncommon.
Yes, because myasthenia gravis is essentially your muscles seem a little bit more tired than they actually are. So the connection between your brain and the muscle is compromised. And when there's less connection, your muscle isn't as strong. So it fatigues out really quickly. So, my first symptoms were double vision, my eyelids would droop. Just general fatigue. I've always been very active, but I swam growing up and I had a difficult time swimming. I would get very tired, and that kind of thing. But then it progressed into these breathing and swallowing issues. And so that went on for about 12 years. And I just became very frustrated by it, being in and out of the hospital, having medications that I was allergic to, and never really feeling a full resolution of my symptoms. I was kind of living in fear of when my next flare-up would be because I couldn't figure out the triggers.
It's particularly terrifying for people with MG because you literally feel like you can't breathe.
Yeah. And it's funny because I would sit there and I would wonder, am I making this up? Is this a real flare-up?
Then it becomes a terrible mind game.
Yeah, it was really hard. There were no real triggers, and I was continued to be active throughout. Especially even the really difficult times of my illness. And so I would continue to run, I would continue to swim and try not to let that get to me. And so when I became very frustrated, I started seeking out other forms of treatment for this, trying to get at something that's more of a root cause as opposed to just a Band-Aid.
What time did you start looking?
This was in 2018. So I had this for 11 years at that point.
You'd already gone through college and PT school, right?
Yep. So I went through college. I had about 4 or 5 years after college before I went back to grad school for physical therapy. I had a really difficult time in physical therapy. Because insurance changed, I wasn't able to get a lot of medications. And so I was actually getting plasmapheresis once a week or sometimes even twice a week I think it was 6 months.
Which is essentially the last line of therapy for that because it's so intensive.
So intense. And I would get really sick afterwards. I would get my blood pressure would bottom out. It was a lot of nausea, vomiting.
Yeah.
It was really not fun for me.
So 2018, you'd had enough.
Yeah, I had enough. Very much living in fear of when my next flare-up would be. Because I actually remember one time I was training for a marathon. I had run a 20-mile training run. And then 3 days later, it was in the hospital. So it was just, I had no idea when it was going to flare up. It was really difficult for me. So in 2018, I started out seeking out a functional nutritionist. I had heard her on a podcast. I liked what she said. She seemed pretty thorough, pretty systematic about how she treated people. And that was the first time that I really took a look at nutrition and how nutrition can and does impact inflammation within your own body. And I really did get a lot better from it. I think that we cleared up a lot. I think that I was less susceptible to getting these random flares. And I think that during that time, I actually hadn't had a flare in the 2 years that I worked with the nutritionist, which was great. But I still didn't really feel 100%. I probably felt about 75%, which is pretty darn good. considering I was still very active and doing pretty high intensity things at the time. So 75% was good, but I wasn't really thrilled. I was still really tired a lot. And my husband and I were just kind of on the path of trying to feel better. And we came across a lot of the quantum biology, circadian rhythm type things, and understanding how EMFs really impact our life and just how they kind of make me personally feel really drained and tired. But I would never have known that if I hadn't come across all of this. So we started to really change how we lived. We started becoming really weird, changing our light bulbs at night, turning off Wi-Fi at night, being outside as much as we could. And that definitely helped my energy levels. But there was still something nagging. I still didn't feel great. This was around COVID or just after COVID. And I was working in a hospital at the time, and they were encouraging us to get the COVID shot. I was really weighing whether or not I should, and understanding that something like that would absolutely flare up your immune system. I understood that there was a risk of me getting a myasthenia flare from that.
What did your doctors tell you about that at the time?
So it's interesting because I don't think that I really consulted them on it, because I didn't think that they would say anything that would convince me either way.
Okay. Did you get the flu shot every year as a PT?
Yes, I had to. And I was fine with the flu shot, and no adverse reactions to that, at least. And so when I got the COVID shot 2 weeks to the day after my second one, I ended up in the hospital with a big flare. And I remember going to the ER to wait to get my, and the ER doctor asked me, have you had any UTIs, any, sinus infections or anything like that might cause this flare? And I told him, no, the COVID shot. And he said, no, it probably wasn't that. I was like, okay. So I had that flare, and ever since that, I felt really bad. I never really felt like I came out of a hole, and try as I may with, different things like red light therapy helped, things that stuff helped, but nothing really got me out of the hole that I was looking to get out of.
What was it like when you first found this sort of more root cause, systems-based functional medicine approach? That got you, was it all the way better, 90% better?
I'd say 75 to 80% better.
Okay. And you were where when you found it or sought it out? 10, 20%, 30%?
I was probably about, I'm going to say 40 to 50%. It took time to get there too. So at first I didn't know that it was helping.
That's a really important point, because a lot of people throw in the towel, not realizing that consistency is key and healing is not linear. So you wind up with these exponential patterns of, I was consistent for 3 months, 6 months, a year, and now it's starting to bear fruit.
Yeah. And it happens gradually over time too, right? So I didn't even realize by the time a year came around how much better I was actually feeling.
People forget.
Yeah.
We have to remind them.
Yeah. If you change little by little, it's like watching a baby grow, right? Like you don't realize all of a sudden they're huge.
That's
they're
right.
And you're like,
That's
where did
right.
how did I get here?
Yeah. So you got to 75 or 80%, and then the COVID shot took you backwards. Fair?
Absolutely. I was probably back at about 40%.
0 is like, in the ICU intubated.
Yeah.
On a mechanical ventilator. Okay.
Yeah.
And 40% is in and out of the hospital, not feeling well.
40% was like when I got out of the hospital.
Oh, okay. Okay.
Yeah.
So there was a lot of up and down in there, I assume.
Yeah, absolutely. Yeah. I was feeling pretty bad for a while.
Yeah.
Yeah. It's just hard. And then I found the quantum stuff that helped, probably brought me to about, let's call it 60%, feeling a lot better, but wasn't quite there. At the time I had continued eating well. I had been able to add back foods that I hadn't been able to eat before without any issue.
What kind of issues would you get when you ate foods that you were sensitive to?
Well, one time I had a beer and I ended up with a full-blown, like my eyelids were drooping and I had double vision.
Yeah. Yeah.
So that didn't happen with everything. It certainly happened with more gluten-based foods, but eventually I was able to even, eat more sourdough breads and whatnot. And even, occasionally some just like regular bread and pasta without issue, without fear that something was going to happen, which was really nice. Yeah. And so then I was feeling a lot better from the quantum strategies, and maybe even got back up to about 75%. And that is when I met you for the first time, because you had a course on minerals. And that was probably one of the more compelling things that I had heard, because, minerals are metals, right? They interact with our environment in very specific ways. And, it kind of brought things a little bit more full circle as to, well, why is it important to go outside? Yes, like it is important to go outside because there are pathways in our body that respond to different light frequencies and whatnot, but also because the metals in our body, which are abundant, change and interact with our environment. And if you have an imbalance of these metals, then it would make sense that there is dysfunction along the way as well, right? And that's something that I had never really considered for myself. And, it is a pretty complicated thing to consider, to understand the interactions between metals and, you increase one, decrease another and whatnot, and how our bodies respond to that. And of course, everyone's very individual, so you don't know how that will manifest. But understanding that interplay between different metals is extremely important. And I felt like you had that little link that it was a link that I was missing. And then another thing was that I really appreciated that you are a medical doctor, because you have this training that a lot of these other people don't have. And that's not to say that these other people aren't good at all, because I've definitely seen benefit from them. But there are many times that I've seen someone and they've said, well, I have the cure for you. I have the fix. This is definitely what it is. When maybe it's a piece of it, flipping a piece of my problem, it led to a lot of inflammation that I think was contributing to my flare-ups and whatnot, but it wasn't the only thing. And so having this more comprehensive understanding of disease, different modalities to treat disease, was really appealing to me, because that's something that I think was lacking in the other avenues that I sought out.
Absolutely. Yes. We see that a lot.
Yeah.
And we take care of a lot of people who feel like they've seen everyone, tried everything, and are wondering, what else could there be? What else could I be missing? A lot of them are, I would say, jaded, skeptical, maybe soured by their experiences with other practitioners, practices.
I get it. It's really difficult to meet with somebody and hear them say that they have the fix and then not feel 100% better afterwards.
Yes.
Very
people
difficult.
Feel sold, like they were overpromised and underdelivered.
Absolutely.
And the sad thing is that when you don't do that, because we actually have to really spend a fair amount of time getting people comfortable with the level of uncertainty that is a reality in medicine.
Yep.
I had a really long conversation with a woman just before this call who's thinking of joining the practice, and she's been thinking about it for a whole year. I told her very clearly, I said, because she was sort of like, what do I have to do? And I said, I don't really like thinking about what you have to do, because I don't know what you have to do. You're going to say, I want to make this goal. And I'm going to say, here are the tools we have in the toolbox. And here's what I would do. And you're going to come back to me and you're going to say, maybe I don't want to use this tool, or I'm not open to that tool. And I'm going to say, okay, but if you tell me that you want to build a house without using any power tools, it's going to take a lot longer, be a lot more involved.
Yeah.
If you go ahead and just pull out the reciprocating saw and the power drill. And that's just part of the deal. Thank you for sharing all that.
Yeah, absolutely. I understand it. I think that we live in a day and age where we are overpromised. And I think that medicine, while it can be really great and it has helped me very much, it has conditioned us to want a quick fix for things.
And a quick answer, a label. I have myasthenia gravis.
Yeah.
And the treatment is prednisone.
Never.
Yeah. Right. And it's a little bit more nuanced to say, well, you have a complex, autoimmune condition that is being driven by elements of your diet and your lifestyle and your environment. And when we alter enough of those conditions, then the complex condition that you've developed will change and maybe even go away.
Yeah. That's the amazing thing, right? It's understanding how there are so many factors at play. And to the point where we don't even fully realize that, it's how can any one person fully realize how many factors are at play? But one of the things that I really appreciated that you did was you have never thought that you know the exact answer. You've been interested in finding out the answer, but you haven't presumed the answer. And that I appreciate, because it allows me to try different things to improve, sure, because more likely than not, changing something is going to help if you are changing, for the better. It's not like a trial by fire. Usually we're trying to balance something out, but you haven't presumed, oh, this is the one thing that's going to get you there. And so I really appreciate that, because it allows me to improve a little bit, to improve a lot, to not improve much. And so you have a lot of tools. I hate the term tools in the tool belt,
But they are.
but they are, right? And so I appreciate that because there are a lot of different tools that you can use to help a person get there. And
You're reminding me of two of my favorite quotes. So William Osler said, "Medicine is a science of uncertainty and an art of probability."
I like that.
Einstein said, "I have no special talent. I am only passionately curious."
Oh, that's a great one.
And that
Yeah.
is how I feel about getting patients well.
Yeah, because it's a puzzle, right? And
It is. And it's
there's
an
only
ever-changing puzzle. I also say that you never treat, no physician treats the same patient twice because they're not the same patient. They're not the same doctor. Of
Oh,
course, I
I
got
like
that
that.
from, I think it was Herodotus.
I like that too, because I think that that's very true.
It's very
But
true.
everybody has the assumption that it is the same patient. Yeah.
Oh my gosh, I know.
It's really
But here we are.
Here we are.
And so you went through the circadian rhythms and it got you a little bit better from your worst after the COVID vaccine. And then you found us. And then what? And how much better did you say you got with the circadian from the 40% after the COVID shot?
I think I got back to where I was pre-COVID shot.
75 something percent?
Because I was feeling pretty good, but I think I was just more acutely aware of how tired I was feeling and because I had gone backwards. I think that was pretty eye-opening. Because you almost don't know how bad you feel or how good or how bad you feel until there's a big shift backwards. You can look back and you can say,
Yes.
I'm actually not feeling as good as I thought I was, or I was feeling a lot better beforehand and I didn't realize it. Because again,
Yes.
those changes happen little by little and very easy to miss.
Very easy.
Yeah. So I that was really helpful. And so also around that time, my husband and I were trying to get pregnant.
Mhm. This is
And
what, 2021 by now?
yeah,
That was the year of the vaccine.
yeah. So we got married in 2019. We weren't not trying to get pregnant, but he's military and he deployed right after we got married. So we weren't able to really try. But 2020, 2021, 2022 was really when we were trying to get pregnant, couldn't get pregnant. I had found a lovely primary care doctor who does a lot of assisted reproductive technology or medicine.
Is that the practitioner who did NAPRO with you? Oh,
Yeah,
great.
no,
Okay.
she's wonderful and helped me understand that alongside of all of this, alongside of how I'm feeling, I was feeling my hormones were in the gutter. I think my estrogen was very low. My progesterone was okay, but would drop off. And then my free testosterone felt like it was negative. Like that was a big factor as to us not being able to get pregnant. So then we found you and figured, you know what, there's another piece of the puzzle. And I think that you're willing to look for as many puzzle pieces as your patients allow you to look for, right?
Yes.
And so I appreciated that.
If I may, actually, I can actually pull up your hair tests.
Yeah.
And
I've
talk
actually
about
gone on one.
those.
So I was on vacation with my husband. We were visiting his family in Colorado, and out of nowhere, I had a myasthenia flare and ended up in the hospital in Denver. And this was a month later,
And no heavy metals.
apparently.
Very misleading. 8 months
Apparently.
later, we met. We did a NutriVal. What did
Yes.
you see based on the protocol that we started based on the NutriVal?
There were two things in particular that I noticed were particularly helpful for me. One was that we started on high-dose iodine, and I felt a mental clarity that I hadn't had in a long time.
How long is a long time?
Years?
Decade?
No, because I want to say that I felt pretty sharp during grad school and during my residency for PT.
Okay.
So it must have been after the COVID shot, to be honest.
Okay. Got it.
Maybe a little bit before then, even. Yeah, it had been some time. I want to say it was like a year or two. But I felt a mental clarity that I hadn't felt in a long time. You had started me on glycine based off of some of the things that you saw from a metal perspective in my NutriVal. And I was on a lot of glycine. And I remember feeling pretty tired for a little while, admittedly. And that brought us to our next hair tissue mineral analysis.
You were eliminating a ton of copper.
Yeah.
And you were eliminating an enormous amount of aluminum.
Yeah, it's a lot.
One of the biggest aluminum dumps we've ever had in the practice.
Wow, I'm honored.
We've got two people who beat you, trumped you, one 139, another 119.
That's amazing.
It is amazing.
Yeah. Yeah, I was doing a lot of sauna at the time.
They both had a current aluminum exposure, though.
Oh, that would do it. Yeah, no, I that was something that I had gotten, I mean, I had been aware of for a little bit. Like I had changed my deodorants and, didn't stop using aluminum foil. I don't drink out of cans because I don't like soda anyway, but
And beer gives you a flare.
I had already been kind of staying away from aluminum for a little bit too. This was after only doing glycine. We hadn't done any other kind of.
Really?
Yeah, we hadn't
You
done.
didn't do any of the other minerals I recommended?
No, we did other things. Yeah, we did other things, but
Oh.
you hadn't done another hair tissue mineral analysis at that time.
But I mean, I would have recommended usually some.
Yeah, I was on some B vitamins. I was on.
Okay, yeah.
Yeah, I was on a plethora of things.
Okay, good. Yeah, because it's very, I mean, it would be unheard of for just glycine to do all that.
No.
All that in a bag of chips. How often were you saunaing when you were doing this?
Gosh, a few times a week, a lot. Somewhere between 20 and 45, depending on the sauna that I was in also.
Yeah, the synergy between the sauna and the mineral balancing is just tremendous.
Oh my gosh. I felt, and that was the funny thing too, I felt great every time I came out of the sauna.
Yeah. But you were also, didn't you start to run into detox reactions at some point?
That was after we got this test back and we started on a specific protocol based on the hair test. And I started breaking out into hives and it was always coupled with taking one particular supplement, Renamide. It was very potent for me. I started feeling a lot better and it took a little bit of time, maybe a few months. I started feeling like I had a little bit more energy and the other big thing was that I have an Oura ring and I was getting my HRV and that finally started to increase. So prior to this rebalancing, I think my HRV overnight was like 15 to 20. And I knew that wasn't normal for me because I had been taking HRV years prior and it was 70, 80. And so being in, 15 to 20, I felt really bad all the time. And that was with getting great sleep. I was getting really, really good sleep at night. And so it was finally starting to creep up. And I think I got up to, 50 intermittently with my HRV, but it was more regularly, about 40, which was really nice. So I noticed that as we started to do some targeted minerals for the hair test.
You mean the detox reactions and the, okay.
Yeah.
Great. And then what?
And then we got pregnant. It was amazing.
At that point, how long have you been trying?
About 4 years, I want to say. 3.5, 4 years.
And you'd already implemented pretty much everything you could find in the health coaching, quantum biology, circadian rhythms, the whole.
Yeah. And I admittedly, my hormones weren't entirely back to normal because we continued to get them checked with my primary care doctor.
Yes. But you felt like you'd hit a plateau with everything you'd been doing and you
Absolutely
needed something to get you to the next level.
Yeah. Yeah. And so we had been trying to do things with her. The success rate was just kind of like to accomplish what we were trying to do was okay. But next thing we know, we ended up pregnant and that was a big surprise and we were very grateful. And I wanted to continue doing a lot of my supplementation, but I was just really sick in my first trimester. So I couldn't really swallow pills very well.
Yeah. Right.
So, I mean, I figured it would be okay. I would continue to eat healthy once I was able to really stomach things and be aware of getting as many minerals as possible through food. And that's what I did and had a really healthy pregnancy. Felt really good throughout. Didn't have any issues during pregnancy. And then as far as it goes, a fine delivery and postpartum has been okay. That's actually one thing that I would have been very nervous about beforehand. Spoke to my neurologist and he said that the first month postpartum is really the biggest risk of me getting another MG flare. It's because you don't sleep.
Or is it because your progesterone drops out?
Probably a little bit of both.
Right.
Yeah, probably a little bit of both. And so I was nervous about that. And I've been more resilient, which has been nice.
When was your last myasthenia gravis flare?
It was around New Year's 2022.
So that would have been before we met, correct?
Yeah.
So then
Actually, no, that's incorrect. I'm sorry.
Oh, okay.
That was my last hospitalization. I had a flare in the April. I had a flare in the April before I started working with you. It was short-lived. It was
I remember talking about that because we met in May.
Yep. It was about a week long. I was going to be set up to get a home infusion, but they never called me back and I never called them because I was starting to feel better on my own. That was my last flare. It was April 2022.
Okay. So now where would you say you are as far as a percent?
Well, that's a really difficult question because we have an 8-week-old.
That is so funny. That
So,
in and of itself is what you wanted.
right. Which, yeah, and such a blessing. I actually feel, I was talking to my husband and I was saying that I feel a lot better than I think I normally would during this time because I'm not getting, I was used to getting 9 hours of sleep at night very regularly. I took off the Oura ring. I'm not even tracking at the moment. I'm able to function during the day. I take naps, but I don't feel like I need to take as many naps as I think. I don't like napping anyway, but I don't feel like I need to take a lot of them. I'm able to get through and I feel fine. I feel good. So percentage wise, that's difficult. I don't know.
It's a
that
loaded question with a newborn.
Yeah, but she's so wonderful.
But the bottom line is you're well. You
Yeah.
haven't had a myasthenia gravis flare in 2.5 years now, almost.
Yeah. Yeah. Almost 2.5 years.
So
Yeah.
that's very profound. I like to ask people what they give the credit to as far as where coming from where they were initially, which is tough to sort of quantify with you because you have this very clear story of, well, I was here and then I got to here and then the COVID shot took me back to here and now I'm here. Compared to at your worst, what do you give the credit to as far as how much improvement you made? And divvy it up in terms of what gets the credit.
It's true. Oh gosh. Honestly, what gets the credit is my own readiness to change and having a spouse that will walk alongside me, because I think doing it on your own is really hard, especially if you are surrounded by people who don't necessarily understand or agree with or believe anything that you're doing. I think that that's really difficult because even within my own family, I've had family members ask, well, why are you eating this way? Or why are you, my dad calls us the mole people because our lights are, amber at night. And,
right. Now he's got his granddaughter, so he can say whatever he wants.
Yeah. And I would say that I don't think that it's one thing. I think that the big thing is readiness to change, because there was a time where I was not ready to change, where I was not ready to implement any of these things. And the second that I really committed to doing so, because the thing is that none of this happened overnight, right? Small hinges along the way that swung big doors.
So funny. We say that all the time.
Small hinges. Yeah.
Small hinges swing big doors.
I think it's doing the little things along the way and being patient and understanding that it's not going to just change overnight. Those two things have been massive.
You guys did do the HTMA course.
Yeah. Yep.
So, but you did group coaching, you had one-on-one consults, you did supplementation protocols, and you put all that together in the right combination formula for long enough. And that's what got you the results.
Yeah, absolutely. Yeah. It's been all the little things. I can't say that it's been one particular thing, which has been nice, because I think it's also very easy to get hooked on one thing and say, well, this is the one thing that's supposed to make me, the red light therapy is supposed to be the one thing.
It is the death of progress. And it's very, a lot of people end up stuck there and find us when they've gotten to the end of that road.
Yeah.
And they've realized that just that one thing was not going to get them the results they were looking for.
I know. And you can't put all of your eggs in one gizmo, right? Because it's
not a good strategy. So thank you for sitting down with me. I really appreciate your time.
Of course. Very happy to.